Okay, so when Benny sent me this paper, I wrote down a number of keywords. So first of all, randomized control trials, then non-profit organization, healthcare, Democratic Republic of Congo, social impact. And I thought, oh, wow, I don't really know very much about any of these. And then there was the word governance, okay, so I was very happy. Okay, this being said, I then read the paper and I said, wow, this is really not that hard to understand. And I guess we don't see many of these randomized controlled trials, but the great beauty, and I guess that's why it just won a Nobel Prize, is that when these things can be implemented, and I guess maybe the authors of this morning thought, hey, if we could add women randomly to these boards, then our troubles with the referees might be gone. Okay, now unfortunately we can't really do that. But they could, okay, so we have a chance here to actually see how a randomized controlled trial can be applied to the question that we have for the second day today. So I thought that was very interesting to just see how that works. So I'll go through the paper, what I understand, and then also reflect a bit, what people have actually said in general about the limitations of randomized control trials. So first maybe then turn to the governance of non-profit organizations. I also thought this was very interesting. We don't say too much of that, but actually we forget that many organizations, including large organizations out there, non-profit, and that we had meltdowns in these organizations. I mean, Germany, we had maybe some of the largest governance scandals actually in the non-profit sector, Christian-run organizations, the Automobile Club, very large organizations, big governance problems. I saw years ago a paper by David Yermak talking about museums as being the organization with the worst governance problems. As a curator can basically do whatever the curator wants with their money, and what does that imply for the contracts. So I think this is actually a very interesting area to study. Mike Weisbach has worked on profit versus non-profit hospitals in the US. So now with this whole explosion about purpose and profits supposed to become more non-profit, I think this is actually something that is good to study. So that just for starters is a very good thing. And in this case, of course, when you talk about development, this is of course also very important. Now the governance treatment in the paper consists of two things. So one, there's auditing. So there's that's auditing. That's not hard to understand. The pro-social incentives I found a little bit harder to understand, because thinking about yesterday, we condition kind of incentives on success. So my first question, and I'll come back to this, is when you are successful in fulfilling the requirements, what do you get? Do you get extra financial resource? But that's a bit of a problem. Alon asked quickly during the break whether you get extra equipment. That's an obvious another question. I mean, what do you get? I mean, what are your incentives? So I understand the auditing. I don't quite understand the incentive part, especially given what we talked about yesterday. Now then, the setup is, in terms of the outcomes, it's easy to understand. So there are these two outcome variables that we care about. And then the other thing that I found helpful is to actually see a picture of the organization, so it doesn't look like a very complicated organization. On the other hand, there's also a map. Okay, so there are actually lots of these things. So what I didn't really find in the paper is very much discussion about the organization that we're talking about. And actually looking at this and thinking I was the dean of this organization, this is actually pretty complicated. So is this organized as an association, or does this have a hierarchical structure? Who's the boss of each center? Who's the regional boss? Are there control lines? Are there reporting lines? So although this looks incredibly simple, it actually is maybe a more complex organization than one thinks. And the paper doesn't really talk very much about that. And maybe that's something you could explain a bit more. Then the results I thought were really, they definitely meet the Bernie test, okay? And then they're incredibly simple, so, I can just see how this is super attractive. And again, I could just see Alexander and Carl go, wow, this would be nice, okay? You have the women randomly allocated, and there's Bernie's, T stat of 3, the index is just different. There we are, end of discussion, okay? Great, okay. Now, okay, so what does Esther Duflo say? Okay, so she has this slogan, what works? Okay, so that's a good slogan. Now, the advantage, of course, is it's a clear question, clear setup, straightforward statistics, but let's not forget the Angus Deaton, also Nobel Prize winner, a critique, because he says, okay, what works? That's a good question, but let's not forget is about the question, why do things work? Because this is, in the end, what science and Renaissance man was built on. Why do things work? So just saying what works is maybe not good enough. Okay, does that apply to this paper? Well, it does have theory. Okay, so that's good. We are testing a theory, so I don't think that Angus Deaton criticism applies completely here. Now, can we extrapolate from these results? So, could you then add, if the World Bank sees these results, could it say, well, let's do the treatment for all programs that the World Bank does? Well, there Angus Deaton comes in, because before I would, if I had to judge on this, I would say I would first like to understand the organization that we're dealing with here a bit better before I would advocate this. And it's only then that I could say, yes, we can also do this in Burundi or whatever other country we want to have this treatment. And just saying, okay, this works, it's going to work everywhere, that I'm not completely convinced about. So to summarize, to convince me of this, you have to convince us that the incentives are not related to the outcome. So you get more resource and then give Bruce a better outcome in the treatment group. And if that's okay, then the question is, can we generalize from the specific result, which seems then very robust. Thank you.
Questions? Okay, I'll go in the order that is convenient to me.
Very fascinating results. So I taught some students from Congo, both in Frankfurt and in Kinshasa, which was a great experience. And something that always came back was that it seems super important in the country from which tribe you are. So now that you're speaking about social preferences, I think social homogeneity in terms of the tribes could be something that is important, both in the area around the center, but also maybe whether the nurses are of the same from the same tribe as the people that are being treated. So that would just add an additional level of richness, maybe another paper. We have these papers from India about castes and so on. Raj has been doing stuff. So that could be interesting to explore.
Fascinating paper, yeah. Do you have two governance treatment? One is incentive to get additional funding. The other is auditing, which also includes the coaching on management skills. So I wonder whether it is incentive or I suspect they don't have a basic management skill. So is it more of the management skill they need? So I don't think you can distinguish between the two, but that would be interesting to see.
This is really a clarifying question, and I know this was brought up by Marco, but I'm not sure I understood what the pro-social incentives were, so I'm wondering if you can describe that a bit more.
I also have a clarifying question. I don't know if I missed it, but I was a little bit struck by the fact that in the first table, one of the most important results was the fact that efficiency goes up by the fact that the number of employees goes down. And I don't know if I missed this, but if they get more funding, and the improvement in efficiency comes from firing people. I just did not understand it.
Thank you. So, first of all, Marco, thank you so much for reading the paper and your valuable comments and all the good questions as well. But thank you. I'm Swiss, so I greatly appreciate your time. Let me.
I even ran over by 1 minute.
Well, you're German. All right. So, in terms of pro-social incentives, so this is really, there are two key differences to the more traditional financial incentives that we know of. One is pro-social incentives are linked to the social performance of the organization, not the financial performance. And the beneficiary is the organization, not the employee. It is nevertheless a financial incentive in a sense. So this is not a term that we came up with. This is a term that is used in the literature, pro-social incentives, that it is money that the health center receives. So provided that you achieve a certain social performance, the health center receives money, and they can do pretty much what they want, correct? So there is a risk that they... So it's not linked to our outcome variables, but I agree with you, we should probably provide more details in the paper. So it's a whole questionnaire of I think 16 pages, several questions about the cleanliness, hygiene, the treatment of patients. So the World Bank, who conducted that experiment, they were primarily interested in the patient behavior. Does it, by improving this governance, does it help improve the patient behavior in terms of taking the drugs, coming regularly to the health center, etc., etc.? So this relates to your question of whether it's related to our outcome variables. It's not. It is related to kind of hygiene, procedure. Do they conduct for example, the World Health Organization provides pamphlets of how to conduct a C-section, etc., etc. The question is, do they actually follow those procedures, correct? Or do they store the medication in a way that they are supposed to be stored in the fridge, first in, first out, as opposed to, you see what I mean? So these are kind of the criteria they're assessing it. In terms of Zach, great comment about tribes, etc. So I'm less, I think it would be a different paper. I agree with you, that would be important to look at. I'm less concerned in our case for two reasons. One is it's randomized, correct? Secondly, we do look within health district. So we compare health centers within health district, which we could double check whether there's any thing going on in terms of tribes. But unbundling the bundle, I would love to unbundle the bundle. Is it pro-social incentives or is it auditing that is really driving the effect? I would love to know. We cannot do it. Unfortunately, we cannot do it with this experiment because it's the bundle. Anna's comment, great comment. So I didn't have time to get it. So improved governance leads to improved operating efficiency, but is it really that they reduce employees? They don't cut employees. So what happens is both treated and control health centers, they increase employees, they do have more funding, so they hire more, but the treatment group compared to the control group hires fewer staff members. So as such, what you see is basically a reduction compared to the control group. Yes?
So can you tell us a little bit more about all these groups? You said, individuals who are located out there, right? These are already a selected group of individuals who are very social anyway, right?
You mean the doctors and nurses?
I mean, everybody, right? The nurses, everybody who's there. Even if they were located in Boston, they're already a selected group. And on top of that, if they're located in there. Mm-hmm. So when you're trying to treat them, I mean, I'm sort of just wondering, how far more can I get that entity to improve? And I already kind of talk about individuals who are kind of doing something that most of the people here don't do. So what is it about the social preferences that you think that you're altering when these people kind of live in this rural area, kind of already kind of standing up and kind of, I'm so still struggling to see what is it that the extra...
I'm going to answer your question more directly afterwards, but just to make a comparison, We care about teaching.
Mm-hmm. Right.
Do we? I'm just letting that stand in a room. Kind of in a sense of how can you incentivize us as professors to improve our teaching, correct? In a sense, it's how do you improve, make sure nurses and staff members
Right, but
and
that
doctors
comes-
who are actually working in a health center.
That's right, but that's norms, culture, right? So that again, so when you talk about norms and culture within a very rural area where there's like, I don't know, a very small number of people around us and we're in the forest somewhere, and again, we've selected to be there. What else about the cultural norms are you, so again, if you had to design the perfect test, but forget about this test, what is it that you would be looking for to see that these guys are getting more out of themselves, that they're not getting already out of themselves, but already kind of being there and kind of standing up? You see what I'm saying? I'm trying to figure out, you know, most of us teach in places where there's a lot of norms, you know, even beyond the ratings that we get. So there's formal systems and informal systems. What is it about these, what do you see as the systems that exist in rural Congo that you can improve on? Can you give me an example?
So one is the pro-social incentives per se, that if you feel you can actually get additional funding for a center that is not well funded, that lacks
But then it's
financial
not, but then it's Marco's point. Then I don't know that it's like a norm or written or unwritten. It's more like I'm getting an additional machine. It's different, no? I mean, so it's not like a teacher, now you're getting 5 more TAs to help you. So of course you're going to be more productive and a bit more efficient teacher. Your point before was like, I'm a better teacher because I'm going to be somewhat more committed because I see my colleagues kind of be more committed, or something which is, again, more intangible. I don't know. We can talk about it later. I'm still struggling to see the difference, whether it's more financial.
It's a good question. My sense is it's not necessarily intangible, it's more the
More than
one
just
is
the,
the knowledge and information, correct, how to do it actually better, but the other thing is also
but then it's
the
not
financial
governance, is
constraints. And
it?
if you get better machines, what's the screening device called? Sorry. Thank you. You can actually literally perform better, correct? So my sense is this, but
I'm looking at Xavier, by the way, and of course I'm thinking about his thesis, you know, and being kind of away from headquarters and
I was
under
slightly
investment.
inspired by his stuff.
All right, we can talk later. Thank you.
There are some positive knowledge spillovers.
Thank you. On-time performance. Now we invite Jacques.